Good morning, my name is Valerie, and today I would like to inform you of a silent virus called congenital cytomegalovirus, or CMV, that affects many children each year. Parents have big plans for their children long before they are born, but what if your normal pregnancy all of a sudden renders an unforeseen diagnosis? Congenital CMV is the major cause of disabilities in children, and many infants die each year from this disease. Yet most people are unaware of this disease, and there are no vaccinations. How common is CMV? Well, the CDC reports that CMV is the most common congenital, which means present at birth, viral infection in the United States, and it affects approximately 1 in 150 babies each year. About half of infants with symptoms of congenital CMV infection will develop permanent health problems within the first few years of life, and up to 20% of these babies will die. CMV infects between 50 and 85% of adults in the U.S. by the age of 40. So why is it that we are not aware of this disease when it comes to our children? Most people who become infected with CMV have mild flu-like symptoms or no symptoms at all. When CMV is passed in the womb from mother to baby, the virus attacks the baby and produces symptoms such as an enlarged spleen, liver problems, jaundice, a distinctive rash, and seizures. Most doctors and medical personnel have briefly heard of CMV, but are not well educated in this field. Therefore, they do not routinely test women or inform them of the risks associated with the CMV infection. As you can see from this bar graph, there are numerous conditions affecting children. This information was taken from an article published in 2006 by Infectious Diseases in Obstetrics and Gynecology. The left side shows the names of common conditions affecting children, and the bottom of the chart shows the percentage of women who had heard of these conditions. This chart concludes that CMV is not well known by women. Only 22% of women in this study had heard of CMV, compared to the 70 to 90% who had heard of spina bifida, SIDS, which is sudden infant death syndrome, Down syndrome, and HIV/AIDS. As of now, there are no clear solutions to this problem. Antiviral drug therapy is now being evaluated in infants, and vaccines are still in the research and development stage. Until there are proven treatments that work, infants will continue to die each year, and many more will suffer lasting disabilities. Women should be educated by their doctor of this condition and how it could affect their unborn child. Let's get the word out and make the difference in the life of a child and their unknowing parents. Are there any questions from the audience?
Can a CMV positive person donate blood?
Yes. Their blood cannot be used for infants or for CMV negative patients, but they can donate blood, and it can be used for patients that have had a prior CMV infection.
How is CMV prevented?
There are no sure preventions. You can practice good hand washing techniques, not eating or drinking after anyone else using glasses or utensils, and avoid kissing young children on the mouth or on the cheek, as CMV is carried in their saliva.
If it's not a well-known virus, how did you find out about CMV?
Unfortunately, I found out about CMV as the parents I was talking about in this presentation. My sister last year had a very normal pregnancy, and at 20 weeks of gestation, she found out that her baby was suffering from CMV, a virus that we had never heard of. Unfortunately, my niece passed away 2.5 hours after she was born, but this gave me the motivation I needed to learn about this and find out that it is very common, and none of her doctors ever told her about it. And I have had 4 children myself, and none of my doctors have ever informed me of this disease. But it could have happened to any one of my 4 children, It could happen to any of your children. It's just not something they talk about with us. I appreciate you listening to this, and I hope that we can all get the word out and share this with women that we know.